Good morning. Good morning to everyone. As I said on Twitter a few days ago, I will try to make some musculoskeletal injuries discussion in my social media. This time is in YouTube. So let's start with a muscle injury case. In this case, it was um, it was a professional football player, 20 years old, midfielder. He just felt moderate discomfort during a match in the last minutes of the match when the muscle has a fatigue, but he could end the match quite normal. Next day, the pain increased quite a bit, especially with stretching and isometric exercise test. So we performed the MRI, and what we could see was just this image that we can see here. It's a very mild image, as you can see. It seems to be a very small transversal tear of the common tendon, uh, with a little mild or little edema surrounding this area. But it's really confusing. The patient was quite good, just with a little bit of pain, and it was really quite good. You can see here in another in the axial plane and in the coronal plane. It seems in the axial plane that we have probably a complete transversal tear of the common tendon in the most superficial part of this common tendon. But if we look at the coronal plane, it seems that the common tendon is quite normal, just a little bit of edema surrounding this common tendon, maybe a small myotendinous injury, but it doesn't seem to be an affection of this common tendon. The club, as always, was really interested in pushing the player to play. In 3 days, the player felt really much better. He was doing almost everything. Almost everything in the gym, and he started training partially with the team, and the treatment was relative rest for these 3 days and physiotherapy treatment. The question of the club was, to me, was if they could push the player to play a match in 4 days after seeing this MRI and after these 3 days of treatment, and according that the patient really felt quite well. So I just leave you a few moments to think if you could or if you would be able to leave the player to play a match in 4 days. What do you think about it? Would you run through the risk? You're not. Let's see what happened, because 10 days later, sorry, we could see that the player playing another match. He played the first match after this injury, 4 days after. He played quite well. He doesn't play 90 minutes. He just play 40 minutes approximately. But the next week, the week after, 10 days later of this decision, he felt an acute pain while sprinting in the same region, and we perform a new MRI. And as you can see here, it was not a sharp acute pain, but it was quite moderate. It was he felt bigger pain than in the first one, and you can see here that obviously the first injury was a complete transversal rupture of the biceps femoris long head tendon in the common tendon region. So just to compare, this is the first image, and you can see in this area here that the edema was very mild, and the transversal tear was really small. But if we compare to that new MRI, you can see that the gap is much bigger than the other one, and that the edema is very, very bright, small, white bright, and so it means that it's an acute injury. So we need to be careful about injuries concerning connective tissue, as I always say in my speeches, because this kind of injuries are very prone to make a re-injury. Although it really seems that it's nothing or almost nothing, as you can see, we can convert this in a quite severe injury, because after this second MRI and after this second injury, what we need to do was 4 weeks after this re-injury to have a complete and correct scar tissue without surrounding edema. And now the player was training normally and he could play that weekend. And we have no re-injuries until now, and it's an injury that it has been for 4 months. So after 4 months now, in the moment, this injury have no re-injuries. But look that we have here a complete and correct scar injury, quite thin, a little bit thicker in that area. Here we can see a first plane about that. Thick in that area, no edema surrounding, when the player was completely normal in terms of training with the team. So we need to see that the MRI also is in correct fibrotic scar tissue, and not always, in my opinion, according only to patients or players' tolerance. We have to take care about both. So I think this is the first connection, the first discussion of a musculoskeletal case. I think is that if I try to publish one each 2-3 days, it will be better, and I will improve also the recording type, and hope it's useful to someone and you enjoy a little bit. Thank you.